Welcome to Skillcast, the podcast by the London Organisation of Skills Development, where skills are the forefront of all conversations. My name is Nurbanu, and I'll be the host for Season 1. Join me as I dig deep and be a little nosy and find out the story behind the skills our expert guests share with us.
Today I'm joined with Dr. Geeta Bora. Dr. Geeta Bora, go ahead and introduce yourself.
Thank you. I'm Geeta and I run an NGO in India. And this NGO is working in 15 states and we are into education and women empowerment. Basically, we work with underprivileged children and underprivileged women. When I say underprivileged women, they are from slums and remote areas.
So how long have you been doing that for?
This has been 7 years for me. Before that, I was IT professional. I was in US and I was working with so many IT companies in Silicon Valley. And this was a calling where I had to think like I should do something for society. And I decided and came back.
Wow, that's beautiful. I love it when people get these awakenings and callings.
Yeah.
So what was it in life? Because when people get these awakenings and callings, then they normally go through some sort of thing in their life where that triggers that response to say, this is my calling.
Yeah.
What moment in your life was there? What happened in your life?
There are two such incidences. One was with my classmate. I will tell you a small story, real life story of mine. I was in standard 12 and she was my classmate. She was super topper and she topped entire India. Her name was in news. But after that, her father decided that she should not continue her study. And I was a very average student. But my parents were very supportive. They sent me to US. I studied there. I worked there. But one day, that time there was no Facebook and Instagram. So we lost the contact. But when I returned to India, one day it was by surprise. I found her in a grocery shop and she was packing stuff there. And when I asked her, she said my father didn't allow me to study and she had an alcoholic husband and 2 kids. So this changes my life because there are so many such girls who don't get opportunity to work. And there is another incident where I was in India, Delhi, and I found rack picker kits. And there were 2 girls who were searching for used sanitary napkins. We all know that menstrual health and hygiene is a big issue in India still. And they was looking for used sanitary napkin. I just checked with them what you will do with that. They were saying like they wash it and they reuse it. And that was a reopening. I mean, it was like eye-opening thing for me. And I thought like, and in India, the kind of sanitary napkins are there. You can wash it and you can use it back. So there it started. Like I started this NGO. We started with menstrual health and hygiene. We do a lot of awareness there. And for education, we work for girl child where we support them. And we do counseling of parents as well. And those scholarship programs.
Oh, wow. That sounds so thorough and so nice. Do you have any family supporting you with your endeavors?
No. My family thought like I'm mad, I'm returning back. Because in India, it is like going to US is a big thing. And but now they are not very supportive, but yeah, they have made peace with it.
So that's quite interesting as well. So I've been born and been living in the UK, in London, all my life. And recently I said to my mom, I was like, I wouldn't mind living in India. I think it just feels home, like your roots are there and you just want to be close to your community and be able to serve in that capacity. So no, that is completely fine. You're not the only one. So in terms of family-wise, does anybody support you? Like, or are you just alone when you do with your NGO? Do you have any family members that are also part of the NGO?
As I said, that way they are not very supportive, but I have 2 kids which my mom takes care. Other than that, these kind of work, because see, I came back from US, they still feel that I should return. However, it is like other people are supportive, definitely, my colleagues, my friends, and there are many people who have joined our NGO. So we have 200 plus people some are employed, some are volunteering. That way I have a lot of support, because good people you can find anywhere. It need not be a family member. But yes, this is the motivation which is keeping me alive, I think, that we should do something for society. And I feel like family member will come someday or other.
Yeah. And you're living your purpose right now, and you know that's your calling and that's your purpose in life, that you want to educate people on women health and hygiene. So I think it's incredible, and it's so niche as well. Do you work on any other projects as part of your NGO, or is that your normal speciality?
When I say we work in education or in women empowerment, there are many initiatives under that. So education is like underprivileged children. There are so many dropout kids. There are so many parents who can't afford their kids' education. So they go to government school, but there are so many government schools where teachers are not there. We have a program in India which is called midday meals. So kids come just to have that meal, even though there is no teacher. Kids come, they stay in school for some time, they have their meal and they go back. So in such schools we are providing teachers. And for girls, I told you, like, there is still a gender bias in India. So if there is only one kid can study, then it will be always be a male child. So that's the thing. So we support a lot of girl child education. And in women empowerment, what we do is we have so many skilling programs which we do so that we can empower these women. There are so many women who are doing micro-entrepreneurship. There we help them so that they can start their small businesses. Other than that, we have other programs related to health, because we are in women health, reproductive health, menstrual health. So these things we do. There are so many health programs which we do, health camps we conduct. So there are so many things going.
And the people that come to the camps, are they mainly volunteers?
To help, yes, they are volunteers. And those who come to our camp, these are the people who don't have access to any health hospitals or anywhere. Because if you see in India, there are one doctor per 10,000 people. So there are so many areas where there is no hospital, there is no access. So we set up camps there. And mostly we go by women health, because they are the people who are neglected more. And male, they travel to so many towns and they get their health checkups done. But women and children are the people who need support.
So when's your next camp?
Ours is next week.
Oh, so soon.
Yeah, every week we do.
Oh, it's a weekly camp.
Weekly camp. Yeah.
Where is the camp based?
It is, we are working in 15 states. So right now we are focusing on Punjab. I think you might be aware of that region. Mm-hmm. So Punjab villages, we have 36 villages. We have identified those villages. And there we are setting up. After that, we will be moving to Uttar Pradesh.
If there's anyone that's interested in helping out in the camps, how can they reach out to you?
We have a website and we have volunteer programs. There are so many college students who come for their internship. That way also we help, and we are a known name in India, so people just say like we want to volunteer. State-wise, we have our team and we have portal where the people can register for volunteering, and that's how it happens.
Wow. So if someone was interested in the internship or volunteering, what sort of skills are they likely to get by working with your organization?
So not just in our organization, I believe that people should work for internships, especially students, because with NGO you learn a lot. It's not just social service. You learn leadership skills, people skills. That's why so many big universities have made it a program to do internship. Even in India, IIT, Symbiosis, so many management colleges have introduced this program that you should work for an NGO. It's not just for social work, it's also for your own capabilities and all. You can increase with that. And people management and leadership is something which you can learn from any NGO, and that is the skill which matters a lot in all the professions.
Sounds amazing. Thank you so much for chatting with me. I had a really interesting and insightful conversation. Thank you.
Thank you.